Well, new this morning, some really troubling news. The CDC reporting drug overdose deaths rose by nearly 30% in 2020. No surprise, the pandemic is to blame as people found it difficult to deal with isolation, job losses, and a whole lot more. So where does Arizona stand, and what can we do if you or somebody you know is struggling with addiction? So joining us this morning to talk about this is addiction specialist Sarah O'Brien with Ark Behavioral Health. I believe you're joining us from Massachusetts. Sarah, good morning. These are really troubling numbers. I mean, we're talking 93,000 people died this past year from overdoses.
Yeah, we've seen a complete spike in terms of people entering treatment, people suffering, serious health conditions, homelessness, and even the lack of resources available due to the pandemic.
And Arizona, by the way, was 13th on that list, with also an increase in the number of deaths. Where do you turn to help? Let's say you've got a family member that's got addiction problems. Where do you go for that first step of help?
So there's a lot of resources available, via the internet, in the communities. One of the greatest resources is probably the SAMHSA website, the Substance Abuse and Mental Health. It kind of targets different areas and allows you to seek help, in the area that you're in with the finances or resources that you have available. You can also call it 1-877-295-7815, and we can help you find a treatment center that's, works with you.
Hey, Sarah, what kind of drugs are we talking about? Isn't the opioid problem the biggest problem right now?
Absolutely. And, we have seen quite a spike in alcohol abuse as well. However, with the opiates, it's become, it's not just using and getting into treatment, it's using in death, with the laced with fentanyl, with the high potency. It's very, very dangerous that we see younger and younger individuals entering treatment quicker because of that reason.
I recently spent some time in Kingman, Arizona, where they are working out in the community as much as possible to take care of their drug overdose problems. And they use Narcan, naloxone, quite a bit to save lives. How important is that?
It is so important to have it readily available if you or someone you love is struggling, just to keep it on you, to be trained properly. There's so many different options for free trainings, for free Narcan that is available in all communities, just to be safe, to be prepared, to save a life if need be.
And so one more question. What kind of advice do you have for families? What should they be looking for if they suspect drug problems?
So a lot of it is the change in behaviors. It's, the irritability, it's the anger, it's, a loss of a job, it's financial insecurities, it's disheveled appearances. It's a lot. And I think for a lot of families, they can quickly see, but accepting it is a whole different thing. Just reaching out to addiction counselors in your area, intervention specialists, people that are trained in this to be able to assist you in helping your loved ones seek treatment.
Okay, Sarah, thank you so much for your time this morning. It's a huge problem. Hopefully we can tackle it down the road here. We appreciate your time this morning, though.
Thank you.
Take care now. Fentanyl overdoses are happening at an alarming rate. So arm yourself with information to keep your family safe during an Arizona's Family Special event. One pill can kill. Get the facts on fentanyl, happening Wednesday, July 28th. You'll want to tune into our newscasts and Facebook Live as we share important resources to help answer any questions that you may have.